Hi, my name is Dr. Rudra Mohan and through the Oral Health channel today we're going to be talking about bimaxillary protrusion. Let's start. So today's episode is going to be very interesting. Let me just put it out there as a statutory thing that I am not an orthodontist per se, but I am a periodontist, a gum surgeon, but I deal with a lot of patients coming from the orthodontic background where they have something known as bimaxillary protrusion. That means bi means two or both, maxillary means jaws and protrusion means that they have flared out teeth. Now this bimaxillary protrusion can be of two types. It could be dental in origin and it could be skeletal in origin. Dental means that your teeth are aligned in such a manner that your teeth seem to be flaring out and outwards, right? And in terms of skeletal malocclusion, it could be just that the jaws are misaligned in such a way that there could be vertically, excess in the lower, jaw. There could be anterior-posterior, discrepancy where you feel that your jaws are aligned in such a way that both of the jaws seem to be flaring out towards the outside. Now, depending upon whatever your case is, most likely all the patients who are undergoing this kind of phenomenon such as bimaxillary protrusion, it creates a sense of underconfidence, it creates a sense of anxiety for them because of the fact that their speech might be impaired, their smile line is different, they have a high gummy smile and they feel that their teeth are flared out, which obviously gives them a look that might not suit, go well with what they perceive of what the natural sense of being confident is all about. Now, while I personally feel that no matter what your face is like, you are a beautiful person with whatever that you have been blessed with, but because of the fact that we live in a societal construct and there are some things which are known as beauty standards, I feel that people who feel underconfident or somewhat they feel anxious that their teeth are flared out, this episode is for them, just to tell them and guide them what you can do in such a case. Now let's talk about what a bimaxillary protrusion case looks like. Most likely the patient complains of a smile which is very toothy, a smile that you feel that the teeth are flaring out, they are coming out, they're protruding. They might also complain about a gummy smile, incompetent lips, muscle strain that the lips don't close when you are staying quiet or when you just at a resting position, you feel that the lips are not closing, you feel that the lips are slightly open, and that kind of creates a sense of underconfidence in patients. Now what can be done in such a case? Now if it's a dental malocclusion, which is bimaxillary protrusion, that means the teeth are tipped in such an angle that the anterior segment or the anterior teeth are tipped anteriorly, they're tipped out, right? Then you can go for the braces options, which might require the extractions of the wisdom teeth and the first 4 premolars depending upon the case and the severity. Now, and if it's skeletal, you might also, if it's a very severe case of skeletal malocclusion, you might require orthognathic surgery. A lot of times I get patients who are scared of getting their teeth extracted, and especially about young adults whose parents are very apprehensive with the fact that we don't want to get the wisdom teeth removed, we don't want to get the first 4 premolars extracted, the teeth are present in the arch or in the jaw for a reason. Please let me remind you that the risk versus benefit of getting the treatment done in terms of the quality of life of the individual, in terms of aesthetics and smile, is something that really outweighs the sort of risk of losing 4 teeth out, which might not have that big a function, that great a function. So what happens is once you take out the first premolars and you create a space, now after the space has been created, we classify the 2 areas, the area before the extraction socket as anterior segment and the area after the extraction socket as posterior segment. What is theoretically the concept of maximum anchorage space is basically that you use this space as much as possible to make sure that the anterior tipping of teeth is taken inside, to make them as straight as possible as theoretical beauty standards hold and functional standards hold, and taking the posterior segment slightly forward so that the space is closed gradually with the help of anchorage. Now anchorage is a concept in orthodontics which means that you use something that is very sound in terms of its foundation, and you can use that to move the teeth at the behest of the support of that part of the oral cavity. That could be your alveolar bone, that means the bone of the jaw, that could be your teeth, that could be your palatal bone, that could just be extra appliances such as transpalatal arch, implant screws, and these kind of things, extra oral appliances as well. So the concept is that you make sure that the whole complex comes in a very harmonious fashion, so that the space is closed, and also if you have wisdom teeth which have erupted, they are also extracted. Now the chewing efficiency of the teeth is not hampered, to be very honest, as long as you are taking care of the teeth and the instructions that are given by your orthodontist. Please make sure that whenever you're going for a braces treatment, you visit someone with a qualified degree in orthodontics and dentofacial orthopedics, not someone with a diploma. I don't mean to slander people who've done that, I don't mean to question their credibility, but your best chance at getting better in terms of crooked teeth is to go to an orthodontist. That's very important. I'm a periodontist, but I feel that I have a lot of patients who are from this background who need to know whom to go to. That's why I have initiated this episode, that despite the fact that I am not an orthodontist and I am not an expert of this field, I want you guys to go to a particular field which is known as MDS orthodontics in India and other places, or someone who has done specialization in orthodontics. That's very important. Now this treatment can take up to some time, and if the occlusion or malocclusion rather is skeletal, that means there's a discrepancy in the skeletal thing, the jawbone symmetry and the jawbone relationship, you might for severe cases have to go for orthognathic surgery, and that's another story altogether. All you have to do is, very simply put, on a very candid note, if you are going through this kind of a thing when it comes to your teeth and you feel apprehensive, call up the orthodontist office, get some scans done, get your tests done, show up for a consult, let them speak to you, let them ask you what your problem is, let them find out a feasible practical solution which can lead to the best possible results with minimum collateral side effects. So that is the only sole responsibility of this video that I've created, that whether if you're feeling that it is impacting your quality of life or your social life because you have teeth that are flaring out, they're protruding, you have a gummy smile, it is always better to seek the help of a dentist, and especially an orthodontist in such cases, and you get the treatment done and follow all the instructions up to the hilt. That's the biggest terms and conditions applied for all patients. You have to follow all the conditions, all the directions, all the instructions to the hilt. Then only your treatment will be successful and you will find a better smile in some time, but you will get your confidence back, or you'll boost your confidence, whatever suits your cause, and you will feel better about yourself, and then you can live in this societal construct of social animals such as humans, and you can do whatever you want to do with your life in a very beautiful manner, and so that you can enhance the oral health related quality of your life. Now that's very important. For me as a doctor, as a dentist, it's absolutely important that I have to make sure that my patients feel secure about themselves, right? It's not my job to make my patients feel insecure. You're beautiful as a person, but all I'm trying to say is that if you feel that this is something, that your teeth being flaring out is something that affects your confidence, affects your social image, affects your self-esteem, might as well, if you have the resources and the finances, get a consult done with an orthodontist and go ahead with the braces treatment. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly as I might be busy with patients. Just drop me a message on WhatsApp with your name, location, and the common oral health problem that's giving you discomfort, and I'll probably get back to you on message via WhatsApp in a couple of days. Be patient, and if you have any queries, doubts, apprehensions, or insights, please feel free to put them into YouTube comment section. So that's it for today. Thank you.